You wake up, go to the bathroom, or you don't because you're in a hurry. Have coffee, hold your pee during a meeting, eat lunch quickly, spend hours without drinking water, come home exhausted, and when you finally go to the bathroom, you feel burning, discomfort, urgency that doesn't pass, and you blame chance. Blame bacteria that appeared out of nowhere. But I spent decades analyzing patients with recurrent urinary tract infections, studying patterns, investigating habits, and I discovered something brutal. It's not bacteria appearing out of nowhere. It's your daily habits creating the perfect environment for it to thrive. 5 specific mistakes, repeated every day, that weaken your urinary tract until it collapses. Your urinary tract is a defense system. It's not a passive tube. It's an active barrier. It has sophisticated mechanisms to prevent bacterial invasion. Constant urinary flow that washes bacteria away. Mucosa that secretes mucin and antimicrobial peptides. Acidic pH that inhibits growth. Flora of lactobacilli that compete with pathogens. Local immune system that detects and destroys invaders. When it works well, you urinate without pain, without urgency, without infection. But when you make certain mistakes, you sabotage each of these defenses, and you become vulnerable. First mistake, holding urine. You feel the urge, but you're busy. Important meeting, long commute, line at the public bathroom that you avoid, and you hold it. Hours. The bladder fills, pressure increases, and here's what happens inside your body. The bladder has a capacity of 300 to 500 milliliters. When it reaches that volume, stretch receptors in the bladder wall send signals to the brain. You feel urgency. It's a protective reflex. Your body is warning you, I need to empty. If you ignore it and keep holding, the bladder continues filling. It goes past 500, 600, 700 milliliters. The wall stretches beyond the physiological limit. The detrusor muscle, smooth muscle responsible for bladder contraction, becomes distended. Muscle fibers stretch too much, and distended muscle doesn't contract efficiently. When you finally urinate, the contraction is weak, incomplete, doesn't empty fully. Residue remains. 50, 100, 150 milliliters of urine sitting at the bottom of the bladder. And stagnant urine is a serious problem. Bacteria that entered the bladder, and there are always some, constant migration of perineal flora through the urethra, are not washed away. They stay, and they have time. Time to adhere to the epithelium. Escherichia coli, responsible for 80 to 90% of urinary tract infections, has type 1 fimbriae, protein appendages that bind specifically to mannose receptors on urothelial cells. Within minutes, bacteria are adhered. Within hours, they begin to multiply. They double their population every 20 minutes in a favorable environment. Within 12 hours, colonies are established. Within 24 hours, biofilm is formed. And biofilm is a bacterial community protected by an extracellular matrix of polysaccharides. Antibiotics don't penetrate adequately. The immune system doesn't reach it. Infection persists, becomes chronic. Epidemiological studies show that people who urinate only 2 or 3 times a day have 3 times higher risk of urinary tract infection compared to those who urinate 5, 6, 7 times. Because constant flow is the primary mechanical defense. Washes bacteria away before they adhere. Simple, effective, free, but you ignore it. You hold it for convenience. And you pay with infection. And there's more. Chronically distended bladder undergoes structural changes. Muscle fibers hypertrophy in a disorganized way. Trabeculae appear, wall thickenings. Diverticula form, pouches that protrude from the wall. And in these diverticula, urine is retained permanently. Even when you urinate, diverticula don't empty. They're bacterial reservoirs. Constant source of reinfection. And this is irreversible. Permanent structural damage. All because you held your pee repeatedly for years. Second mistake, inadequate hydration. You drink coffee in the morning, soda at lunch, industrial juice in the afternoon, tea at night, and you think you're hydrated. You're not. You're dehydrated. Because caffeine is a diuretic. It inhibits water reabsorption in the renal tubules. You urinate more than you absorb. Negative water balance. Soda has sodium, sugar, phosphates. They increase plasma osmolarity. Pull water from tissues into the bloodstream to dilute. And then that water is filtered and eliminated by the kidneys. You become dehydrated even while drinking liquids. A paradox nobody explains. and dehydration concentrates urine. Healthy urine is light yellow, almost transparent. Concentrated urine is dark yellow, orange, even brown. High osmolarity. High concentration of urea, creatinine, uric acid, mineral salts, metabolites. And this irritates the bladder mucosa. Causes sterile inflammation. Chemical cystitis. There are no bacteria, but there is inflammation. Epithelium becomes damaged. Cells die. Permeability increases. Junctions between cells loosen. And when bacteria arrive, they easily penetrate the submucosal layers, invade deeper tissues, cause more severe infection. And concentrated urine reduces urination frequency because you produce less total volume. Kidneys concentrate to the maximum to preserve water. You urinate fewer times. And we're back to the problem of the first mistake. Bacteria have more time to adhere, multiply, invade. The scientific recommendation is clear: 2 to 3 liters of water per day. Not tea, not coffee, not juice, not soda, pure water, and distributed throughout the day. There's no point drinking 2 liters in the morning. You'll urinate it all out quickly and be dehydrated the rest of the day. Drink 200 to 300 milliliters every 2 hours. Maintains constant urinary flow. Keeps urine diluted. Protects mucosa. Prevents salt crystallization. Prevents stones. Prevents infection. And there are studies that prove it. Women who increased water intake from less than 1 liter to 3 liters per day reduced urinary tract infection episodes by 50%. 50%. Just by drinking water. No medication. No cost. But you don't do it. Because it's inconvenient. Because you need to go to the bathroom more often. And we're back to the first mistake. Vicious circle. Third mistake, inadequate intimate hygiene. And I'm not talking about washing too little. I'm talking about washing too much. And washing wrong. You use intimate soap, antibacterial soap, vaginal douche, wet wipes. You think you're protecting yourself. You're destroying yourself. The vagina and perineal region have resident flora. Complex microbiota dominated by lactobacilli. Lactobacillus crispatus, L. Jensenii, L. Gasseri. These bacteria produce lactic acid. Maintain vaginal pH between 3.8 and 4.5. Acidic. And in acidic pH, pathogens don't survive. E. coli grows better at neutral pH. Klebsiella 2. Candida prefers alkaline pH. Lactobacilli also produce hydrogen peroxide. Hydrogen peroxide. Toxic to anaerobic bacteria. And they produce bacteriocins, antimicrobial peptides that kill competitors. It's a sophisticated chemical defense system. And it protects not only the vagina, but also the urethra, which is millimeters away. When you use soap, you kill lactobacilli. They're sensitive, die easily. pH rises, goes to 5, 6, 7. Opportunistic flora grows. Gardnerella vaginalis, E. coli, Klebsiella, Enterococcus, Staphylococcus. And they migrate from vagina to urethra, from perianal region to urethra. You create bacterial vaginosis. And vaginosis is strongly associated with urinary tract infection. Studies show that women with vaginosis have double the risk of developing cystitis. Proper hygiene of the genital area, water. Just water. Warm or cold. No soap. No intimate products. No douches. No wet wipes with fragrance and preservatives. Water on the external area. Labia majora, perineum. Don't insert anything into the vagina. The vagina is self-cleaning. Doesn't need internal cleaning. And always wash from front to back. Never back to front. Seems obvious, but millions of women wipe wrong after defecating. Drag fecal bacteria directly to the urethral opening. And E. coli from the intestine is exactly what causes urinary tract infection. And after sexual intercourse, urinate. Always. Immediately. Don't wait. Don't sleep first. Get up and urinate. Sexual intercourse pushes bacteria from the vaginal entrance and perineum into the urethra. It's a mechanical mechanism. Friction. Penetration. Inevitable. But if you urinate right after, the flow washes these bacteria away before they climb to the bladder. Studies show a 60 to 70% reduction in postcoital infections just with immediate postcoital urination. 60%. Simple. Effective. But many ignore it because they want to sleep. And they pay with burning days later. Fourth mistake, inadequate clothing. You wear lace panties. Microfiber. Polyester. Nylon. Because they're pretty. Because they don't show under tight clothes. Because they dry fast. And you wear them all day. 12, 14, 16 hours. Work out at the gym in them. Sweat. And keep wearing them. And synthetic fabric doesn't absorb moisture. Sweat, normal vaginal secretion, residual drops of urine get trapped between skin and fabric. Create a humid environment. Hot. Closed. Perfect for bacterial proliferation. And fungal. Candidiasis and urinary tract infection frequently coexist. Candida albicans alters vaginal pH. Compromises mucosal barrier. Facilitates E. coli invasion. And tight pants. Leggings. Skinny jeans. Low-waisted pants that compress the pelvic region. You wear them all day? Sitting. Constant compression on the perineal region. Reduces ventilation. Increases local temperature by 2 or 3 degrees. And bacteria love heat. Double faster. And constant pressure on the urethra can cause mechanical trauma. Microlesions in the urethral epithelium, which are entry points for bacteria. The solution is simple: cotton panties. Always. Cotton absorbs moisture, allows ventilation, keeps the area dry. Change daily. If you work out, change immediately after. Don't stay in sweaty clothes. If you sweat a lot during the day, bring extra panties and change. And avoid very tight clothing for prolonged periods. If you work sitting 8 hours, wear comfortable clothes. And at night, sleep without panties, or with very loose panties. Let the area breathe. Reduces moisture accumulated during the day. Reduces nighttime bacterial proliferation. Fifth mistake: inflammatory diet. You eat ultra-processed foods, refined sugar, white flour, trans fats, artificial colors, preservatives, emulsifiers, sweeteners, and you think this only affects weight, cholesterol, heart. It affects everything, including the urinary tract. A diet rich in processed foods causes low-grade systemic inflammation, chronic subclinical inflammation, circulating pro-inflammatory cytokines, TNF-alpha, interleukin-6, interleukin-1 beta, elevated C-reactive protein. These cytokines affect all body tissues, including bladder and urethral mucosa. Epithelium becomes chronically inflamed. Permeability increases. Protective barrier weakens. Facilitates bacterial invasion. And sugar has a devastating direct effect. Glucose spikes cause insulin spikes. Chronically elevated insulin promotes resistance. And insulin resistance is statistically associated with higher risk of urinary tract infection. Mechanism not fully elucidated, but probably involves immune dysfunction. Neutrophils in an environment of hyperglycemia and hyperinsulinemia don't phagocytose adequately. Compromised production of reactive oxygen species. Reduced chemotaxis. Bacteria survive more easily. And in diabetics or prediabetics, glucose exceeds the renal reabsorption threshold. Appears in urine. Glycosuria. And bacteria ferment glucose voraciously. E. coli, Klebsiella, Enterococcus. Multiply exponentially faster. Form denser and more resistant biofilms. More severe infection. More symptomatic. Harder to eradicate. Diabetics have 3 to 4 times higher risk of urinary tract infection and of complications like pyelonephritis, renal abscess, sepsis. Anti-inflammatory diet actively protects. Green leafy vegetables. Broccoli. Kale. Red fruits rich in anthocyanins. Lean proteins. Fish rich in omega-3. Extra virgin olive oil. Nuts. Seeds. Measurably reduces systemic inflammation. Studies show drops in C-reactive protein in IL-6. Strengthens innate and adaptive immunity. Strengthens integrity of mucosal barriers. And specifically for the urinary tract, cranberry. It's not a myth. Type A proanthocyanidins prevent E. coli adhesion to the urothelium. Block fimbriae. Bacteria can't adhere. Are eliminated in urinary flow. Effective dose: 36 milligrams of proanthocyanidins per day, or 100 milliliters of concentrated juice without sugar. And avoid added sugar. Sodas, candies, industrial desserts, sugary breakfast cereals. Every gram of refined sugar you consume is direct fuel for inflammation, and potentially for bacteria if there's glycosuria. These 5 mistakes are insidious. Silent. You don't feel immediate consequence. It doesn't hurt to hold pee once. It doesn't hurt to drink little water one day. It doesn't hurt to wear synthetic panties. It doesn't hurt to eat sugar. It's gradual. accumulates. Day after day, week after week, month after month, years. And one day, infection appears. Seems sudden, but it's not. It was built slowly. And you take antibiotics. Ciprofloxacin, nitrofurantoin. It improves in 2 or 3 days. And you think you solved it. You didn't solve it. You just killed the symptom. The cause remains. You continue making the same mistakes. And 2 or 3 weeks later, infection returns. You take antibiotics again and again. Infernal circle. 6, 8, 10 episodes per year. Living on antibiotics. And each course has a high biological cost. Antibiotics kill susceptible bacteria, but select resistant ones. E. coli produces beta-lactamases, becomes resistant to penicillins, cephalosporins, develops mutations that confer resistance to fluoroquinolones, and eventually you have a superbug. E. coli resistant to multiple drugs. And when that happens, therapeutic options run out. Last-line antibiotics have more side effects, are intravenous, require hospitalization, and antibiotics destroy intestinal microbiota. Clostridium difficile proliferates, causes severe diarrhea, pseudomembranous colitis, potentially fatal, and unbalanced intestinal microbiota increases the load of pathogenic E. coli in the intestine, which periodically migrates to the urethra, perpetuates the cycle. The solution is not more antibiotics. It's prevention, correcting mistakes, and you have total power over this. Start today, now. Urinate whenever you feel the urge. Never hold for more than 3 or 4 hours. Drink 2 to 3 liters of water distributed throughout the day. Wash genitalia only with water. Use cotton panties. Change daily. Avoid tight clothing for prolonged periods. Eat real food, vegetables, proteins, good fats. Cut sugar. Use cranberry if you have recurrence. Urinate after sex. These are simple changes. No high cost. No technical complexity. But they require daily awareness. Behavioral discipline. Your urinary tract is a resilient system. If you respect it, it protects you. If you repeatedly assault it, it fails. And it fails painfully. The choice is entirely yours. And so are the consequences. Decide now.